Albert, Dr. hand worker psychologist, MD, and nutritionist in PhD, right?
Yes.
And I'm the acupuncture and herbalist. And I came from China, and the East meet the West, we get the best.
I like that.
So today we're going to talk about a case about insomnia. Dr. Albert, you want to present the case?
Right, yeah. So we had a very challenging case of a 40-year-old male patient with significant insomnia, tried acupuncture, multiple medications, was still having a lot of difficulties, go through kind of waves of improvement, and then whatever he was trying would work for like a couple weeks and then it would stop working. And so it's been a lot of up and down kind of cycles. You know, there was definitely counseling involved, which has been helpful,
Yeah.
you know, at different points. But I think it's important to just talk about insomnia since it's such a common issue and what people can do to really help.
So, Dr. Handworker, what do you think insomnia from the mental
Psychological,
medicine?
yeah.
Yes.
Insomnia represents unresolved issues that people have long-standing repressed. They don't deal with issues moment to moment, day to day, usually for a long period of time. And these are issues that they are invested in, not really addressing because they either feel shame from it or they feel afraid of dealing with it. And if those issues are unraveled in the midst of a talk therapy and other kinds of therapies, including acupuncture and herbs and other kinds of things that support the healthy energy of a person, if they deal with them, slowly the sleep can be recovered. A lot of it has also to do with imbalance, which Michelle, my wife, will talk about, in terms of diet and lifestyle is also involved in insomnia. Sometimes people do not know about lifestyle in terms of when they eat, how much they eat, what they eat, also what supplements they may be taking that are counterindicated. So it's the bad habits in lifestyle that contribute, unresolved unconscious and subconscious issues, resistance to dealing with these issues, and a fundamental resistance to just change their life. They just want the thing to go away. They want the insomnia to go away, and they deal with it from the surface. It's important to deal with insomnia from the core issues up through the surface. But if the core is not dealt with, you can change the surface, but nothing will change in terms of the problem itself.
Yeah, I think too many people are on medication
Yeah.
for life for insomnia without actually addressing the
Anything.
underlying cause.
Yes, exactly.
Right?
Absolutely.
Exactly.
So, what kind of diet from the nutrition point? You have PhD in
Yes.
nutrition, so
Yeah.
For this kind of a
Yeah.
long-term
lifestyle.
chronic issues.
Yeah. Well, I have a PhD in holistic nutrition, which brings in a lot of what Dr. Handworker said in terms of a view on life, a view on your own life, and a creation of a sovereign personage to begin with, to take responsibility. So, and that means become more in touch with what you're eating and how it affects your body in the moment or soon after. Specifically, I'd have to ask this person because any dis-ease is a very personal thing, and so the energy and the habits are specific to any given person. So I would have to inquire about their habits. I would have them write down what they eat and imbibe and take as supplementation, and I would study what they take. And then, of course, I would probably suggest that they would see Dr. Lee for an evaluation of their energy. And I might also, I only treat women, but I might also do an AMA treatment, which would give me a very personal sensitivity to their physiology. And then I would go into, basically, I would suggest that they would stop eating around 5 or 6 p.m. and not eat again until the morning, which gives the body a lot of time before they go to sleep to not have to be working on digesting. So that would help in their ability to fall asleep for sure and get a more restful sleep. And then I would have to be specific about what I would suggest about their habits. If they, for example, if they like to drink coffee, I would probably suggest that they would break up a cup of coffee over the day and not have it all at once, and certainly not close to bedtime or even at dinner time, so that the effects of something like coffee or Coca-Cola or anything that they might, I would never suggest Coca-Cola, but if they have that as a habit, I might tell them to slow down gradually so that it's not a struggle. It has to become part of their lifestyle, a change in lifestyle, so that
So
it's
what
not
kind
difficult.
of food do you think can calm down the nerves so that don't stimulate the nerves? Like in the evening, like avocado or any kind of a
Sure.
food
Yeah,
can help
Yeah.
that.
Healthy fat is really important.
Yes.
And of course,
Leafy greens.
leafy greens and things like that, and soups, things that are easily digestible.
Uh-huh.
Brown rice is always good. Things like that. Neutral, things that are neutral. You can have meat. I would also immediately suggest organic food, not to be eating just any old, not to eat fast food, not to eat fried food. These are basic changes that I would suggest.
Processed.
And processed foods, all that. The simpler, the better. Yes, avocado for sure.
I like lemon.
Sweet
because-
potatoes.
Yeah, sweet potato is good too. Yeah. And how did you cope with that patient? When I treat him and then I refer you to the
Yeah.
herbs. What else you?
So, I mean, often we start with like ashwagandha can sometimes help
Mhm.
decrease
Yes.
stress and cortisol.
Cortisol.
We tried magnesium supplements,
Mhm.
right? The
Right.
magnesium glycinate, the magnesium L-threonate, or taurate.
Yep.
Sometimes that helps. Even melatonin people use, but you really want to go with really low dose melatonin. So the
Mhm.
lower the dose tends to be a little gentler, maybe more effective. Sometimes CBD products can help.
Yeah.
I found some studies on lotus root, interestingly,
Yeah.
helping with sleep quality. So I think you're very right about using vegetables like dark green leafy vegetables and really wholesome foods that are easy to digest,
Mhm.
really helping the body.
I also didn't mention specific exercises like Tai Chi.
Yes,
Some
that's your.
gentle yoga,
Yes.
things like that are very helpful.
Yeah, that's
To
calm down
ease
the
them.
nerves too.
Yeah, walking is also very
Yeah,
good.
walking in the
Swimming.
evening, especially in Florida during the daytime, is so hot.
Yes.
What's your experiences about lemon? Because I'm so addicted to this lemon, and I try different time. Yeah, in the morning it will suppress the appetite, so I try not to use in the morning because people who had acid reflux, if they take in the morning, they could induce the acid reflux. But in the evening, it seems to really help me to suppress my appetite.
Mm.
And interesting, like when it goes to the stomach, so if you blender the lemon, you add 4 or 5 ounces water, and after dinner you drink that,
Mhm.
and then it seems like it's making the stomach muscle relax, and so I don't have the urge to eat more.
Mm.
But once it goes to colon, actually it stimulates the colon, so it's good for the constipation.
Mhm.
So, but from nutrition point of view, I think lemon is it has a lot of
Specifically in hot water, I would say.
in hot water.
Yeah.
Okay. Yes, the hot water helps the digestion. So for that particular case, what else you just recommend some herbs or?
So usually we start with that, then we go with medications for anxiety. Sometimes if it's really severe and it's really hard to kind of get the person back to baseline and be able to function, right? Where they can't hold a job, they can't get out and socialize. It's so impairing.
Yeah.
That's where sometimes medication can really come into play, even if it's just like a way to bridge the gap and get them over that hurdle where they can build in the right protective mechanisms and proper, sleep hygiene and diet and lifestyle,
Mhm.
And then our goal is to kind of taper off of the medicine long term, right? But
And then we
sometimes-
hand it to our psychologist to
Yes.
resolve the anxiety
and the way that he really responds to stress, because that's really the issue.
That's right.
A lot of people just they get stressors, maybe they're on the road and someone's honking at them or something, right? And then all of a sudden their body just goes into this fight or flight
Adrenaline.
mode.
Yeah.
And they have so much trouble snapping out of it, and then it sets them back, for like another week. So that could be
Yeah.
Yeah. Unraveling the history of a person's anxiety, their earliest memories of when they felt that anxiety, what was the catalyst of the anxiety, and then tracking it through to their current state is very, very helpful to help people relax and sleep ultimately.
Yeah, because these patterns get locked in the body, literally in the cells of the body. It can get locked in, and that's where, the body work comes in.
Yeah.
Some cranial sacral work.
Yeah.
I do
You
some of that.
practice Tai Chi, right?
Yes.
What's the best time to practice Tai Chi?
Oh, I like the morning.
Did you say best time or what?
Yeah, best time for
Best time.
insomnia. Do you think that in the evening
well,
it could help them?
Before the night.
No, I think the most important thing is that when you do Tai Chi, it should be when the sun is out.
Right.
Otherwise, the earth will take your energy.
Okay.
So the sun has to be out.
Uh-huh.
I like it in the morning and afternoon is good. You could do it more than once for sure. Once in the morning, once in the afternoon,
Yeah.
as long as the
Before the sun
sun
goes
is
in.
out.
Yeah.
And also there needs to be a commitment on the part of any individual to want to explore these things that they're resisting to explore, that are the core issues that cause these anxieties and insomnia. There has to be the willingness of the patient to want to explore it, to want to really come to a solution and not cover it up with potentially only surface solutions. Commitment to change is very important.
Is there any role for like exposure therapy, like having gradually increasing amounts of stress and learning how to respond to that in a positive way?
Yeah, only if it's accompanied by looking at the root causes of what catalyzed it. Because everyone has a unique input on how they deal with anxiety. So the conditioning aspect is good only for persons aware of the core issues. Otherwise, it could just be a cover-up.
Right.
It's part of the rehabilitation.
Yeah, it always return if they don't deal with the core.
Exactly.
So you recently published 2 or 3 books
Yes.
regarding what is.
Well, the first book is called Before Dust Turns to Mud, is the idea of dealing with issues that are impacting you day to day. And if you don't deal with them, they become solidified into your character and into your lifestyle. So the idea is before dust becomes mud, you want to deal with issues sooner than later. That's one book. It is also related to martial arts practice, but it just serves as a medium through which the other theme can be unraveled. It's just a medium. The second book has to do with living the transcendent, which is more of an issue of using principles, universal principles, to guide transforming the unconscious mind into consciousness, so that you can have a greater control over your life and also more meaning in your life when you direct it through a purpose. And the purpose in that book is described specifically as consciousness, enlightenment, consciousness, transforming the day-to-day habits of your life into a more conscious direction that has more meaning and also a deeper connection to your deeper self. And the third book that was just published has to do with poems and prose that deal with, I guess you would say, just dealing with life in a more beautiful way, making life more enjoyable, more clear, to create clarity in one's life, and that creates more peace. It's all about building peace through clarity and through transformation.
I think a lot of people carry their stress as like physical muscle tension.
Yes.
Right. And so sometimes it can present as headaches because people are tensing up their
That's right.
tops of
That's
their
right.
neck.
Mhm.
Right. And then, and so maybe then they start doing some exercises to help it, but they still have to get to the core.
That's
issue,
right.
like
That's
you're
right.
saying,
That's right. Absolutely.
A really good practice, very simple, is to just pay attention to your breath.
Mm.
Just a simple attending. You don't have to do anything, just watch it. And that is incredibly relaxing, but it also is transformative.
Mm-hmm. Yes, definitely.
Yeah, I think we have a big challenge in this country with a lot of veterans who have PTSD.
Yes.
And so it's very difficult for them to adjust back to normal life. And so they have a
Absolutely.
lot of trauma and anxiety.
Yeah.
And, there's different nonprofits like the Herd Foundation in Delray that uses, horses to help, try to
Yes.
rehab,
Mhm.
Yeah.
animals, right, nature. But
Yes.
there's really such a need for these veterans to get help and really understand the core of their issues
Right.
and how to deal with it.
Yeah.
And when I work with veterans, because I do, and I am an
Yes,
expert
true.
in traumatic stress, I always start with the breathing, to be
Yeah.
conscious of the breathing and to try to be controlling it in the sense of taking an inhale in 4 count and try to exhale 6 count. Just when you regulate the breathing and the inhale and exhale, you become not only more conscious, but you become more relaxed. Because if you release a little bit more than you take in, you end up with a better residue of clarity.
Mhm.
That's what I noticed.
Mm.
So conscious breathing, 4-6 is very helpful.
So is that abdominal breathing?
Yes,
Because
yeah.
because Huberman, a neuroscientist from Stanford, he talked about abdominal breathing mimic the breathing during the REM sleep.
Mm-hmm.
So if we're doing the meditation and we do the abdominal breathing, then he said even just 20-30 minutes, you're like mimic the REM, your muscle are paralyzed,
Mhm.
are totally relaxed.
Mhm.
And then you also consolidate your memory, which you learned a few hours or 2 days ago. So
Mhm.
it's not really a waste of time when you.
Oh, no, not at
Of
all.
course.
Yeah.
That's a wonderful method, yes.
Yes.
And I wanted to say about the use of horses. I just recently read something about the reason that's a wonderful therapy is because when a person gets on the horse, the basic thing that they're being taught is to kind of unite with the horse, and that they have to sort of let go of everything that they are so identified with to just be able to be on the horse and allow themselves to just go with the flow of the horse, which comes back to, uh, uh, when we offer therapies of variety of ways, it's all external. What's really, really important is that the patient is able to regain a sense of themselves. That's why breathing is one of the primary things, because that's an internal practice.
Yeah, the willing commitment to work on things is critical as a starting point. You have to be willing and committed to change something that you're not happy with, that makes you feel dis-ease. So that's very important. Also, dogs is a very good therapy medium. Dogs are angels. They're angels, and they respond to your energy. They actually take on your disease, physically and emotionally.
Yeah.
Dogs are known to take on the disease of the person. I've had patients who've had dogs that suddenly died or died soon after they got them, but they became fine. Their disease was healed, and the dog died. And that's a very, very interesting case. I've seen that many, many times.
Oh.
The dogs actually take on the disease and the mental and physical disease of the person that they're connected to.
Mm.
So dogs are very, very, very helpful.
I should have a dog, maybe when I retire.
Yeah, dogs are they're just angelic. They're very special animals.
Yeah, I wanted to ask about like neurofeedback too, and QEEG, and kind of looking at the brainwave activities in different areas of the brain,
Right.
because we have like definitive evidence of dysfunction,
Mhm.
that we can see, and there's a device people can get even at home where they can try and train their brain through neurofeedback.
Right.
What's your experience with that?
Yeah.
Well, biofeedback.
Yeah, we have big-
biofeedback is very simple. There's all kinds of equipment that is just personally utilizable, and it basically measures skin conductivity based upon stress. So when you're stressed, your skin conductivity changes, and the reading in the biofeedback equipment changes. Also, biofeedback in terms of brain waves. When you're more relaxed, you have a different brain wave, obviously, than when you're not. And they've done studies with animals, specifically dogs. When the dogs was present with the person doing the feedback, their brain waves totally changed with the dog present. I'm sure with a horse it'd be more difficult to check, but with a dog it actually works. It actually, or with breathing techniques. People practice breathing techniques, their brain waves change.
Yes.
Breathing techniques, the presence of animals, just the presence of different practices or different thoughts.
So any food, Michelle, you can recommend like helping the body produce more serotonin or melatonin, because menopause women, the serotonin change so much. And the one good thing about menopause is your hand and the feet are no longer so cold, but then the nerves become so sensitive. So I don't have the endurance as I do before. But I try all the diet, like sweet potato, tofu, and whatever it can brings up the serotonin. I will try that. So do you have any suggestion?
Yeah, I mean, I would say deep green vegetables are always critical, yes.
Organic.
Chamomile tea.
Mm-hmm.
A lot of herbs, like red clover is really good.
Saffron can help.
Yes, saffron. Yeah.
Can help us sleep,
Saffron.
Yeah. Serotonin.
Yeah,
And
as you mentioned, ashwagandha.
Do you have a experience with peppermint? Because me and my daughter tried peppermint in the afternoon one time, and none of us can sleep. And even there's no caffeine, it seems stimulate the nerves.
Well, doesn't it have like a heat quality
It basically moves the energy.
Yeah.
Maybe
too much.
If you have it in the morning, it'd be different.
Yeah.
If you have peppermint in the morning.
I
find chamomile.
It's a digestive agitator. I mean,
peppermint kind of stimulate the stomach
across the
board. So maybe
chamomile is much better.
Well, you don't want that.
Chamomile much better.
Yeah, chamomile in the evening.
Dr. Alpert recommended chamomile for.
Yeah, I've been taking chamomile.
Chamomile is excellent. Excellent.
So I still take it every day, and
it's excellent. Chamomile is excellent. Excellent.
Yeah, but then I have the opposite effect. When I drink chamomile in the evening.
Oh, in the evening.
Yeah, I got stimulated.
That's the thing. Everybody's different. And we all change rapidly. So what might happen one day won't happen the next day. It's it's a very delicate balance.
Yeah, we always want to invite people to journal their experience.
Yes.
Journaling is very important, physically, emotionally, intellectually, and spiritually. Just keeping a journal will help you be more conscious of not just your habits, but also how you feel and what you feel when you do certain things.
Yes.
It increases consciousness exponentially. Yeah. Journaling, and if you do nutritional work with my wife, she'll ask you to journal everything you eat for about a week. Everything, what time you eat it, how much you eat, what it is,
reactions,
and your reactions. Exactly.
If you notice them, and it's all about helping you to get more conscious of yourself.
That's right.
Because
that's the theme.
It's an ongoing. I mean, we're energy bodies, right?
Yeah.
Mm-hmm.
So it's ever changing, and like you say, different substances have different effects. Like you mentioned, lemon. I can't eat lemon. I get
sores in the mouth.
Yeah.
And I drink a quart of lemon juice every week.
He's constantly juicing lemon.
Yes.
Organic lemons.
Yes. It's very good for the blood vessel.
Yeah, I find it very helpful.
I think journaling is so important. And when my father was sick with lung cancer and I couldn't sleep, so if one night I got a very good night's sleep, I would write down what I did.
Yeah.
The night, what I did, what I eat, and that way give me, because the short memory also only stays in your brain for 24 to 48 hours.
Right.
So after 2 days, you don't write down, then you forget about it.
Yeah.
No matter how significant it is,
even
unless it's
really
really
totally different person.
Yes. So journaling also make me a little drowsy when I write those boring stuff, and then my brain stops thinking.
No, it's more like what he was saying.
Resistance.
You don't want to hear it. You don't want to face it.
You may be coming upon something you don't want to hear.
Yeah.
Yeah, consciousness is a theme throughout this whole process.
100%, so important.
So if you're gonna treat an insomnia patient, is it? I was thinking, do you think morning time would be the best time to bring up their issues and talk about, right?
Yes.
During the day.
Yeah,
definitely
during the day.
not
Yeah.
too close.
Yeah, I think people go to therapists too late, like 5 p.m., 4 p.m. You stimulate your brain, and then that can.
Or they fall asleep on the couch.
Yeah,
That
yeah.
patient eventually, how he's sleeping.
Well, it's still kind of going through waves. He just had a procedure, which is the dual stellate ganglion block,
Wow.
which is in like the
Wow.
most kind of severe cases when everything else fails. You know,
Wow.
they have this procedure where they can block kind of the nerves that release most of your sympathetic activity throughout the body.
Mhm.
Wow.
And it's interesting because a lot of people, it's interesting, I've just heard this recently that men, when they get it done, particularly on the left side, they tend to react a lot stronger than the right side, where they just kind of have like a let go of all their like emotions like immediately after the procedure, because it takes away, I guess, all this sympathetic activity and stress going throughout the whole body. And I've heard of people needing to have the procedure 2-3 times, and then they'll get a tremendous result. Some
What do they
veterans,
actually do to this person?
so they put ropivacaine in the nerve up here around C6 in the neck,
Wow.
Is
they
that in
didn't
the
do-
back?
towards
In
the
the
back. Yeah,
Yeah.
between by the carotid artery.
Are there any side effects to that procedure?
What is that?
Well, once you get the procedure, you get Horner syndrome, which means it worked, where you get droopy eyelid, hoarse voice, just for a few hours after typically, and then it goes away. And so, very, very low risk procedure.
Have they done
Really?
long-term longitudinal studies? Any kind of long-term longitudinal?
There's not that much, that I found.
Because
in
everything
terms
has
of
a
good
result.
Data, but there are some doctors who specialize in just doing this procedure and have been
Wow.
doing it for decades, and they're very, excellent at it.
Good,
Now we
okay,
do
good.
ultrasound guidance. And so,
Yeah,
but,
yeah.
So then after a procedure like that is when they come to you so they can face all those things. What
yeah,
do-
well, now
Core
the
issues,
point is
core
to
issues.
train. Yeah, you still have to train the core issues and get the
Yeah.
bottom of it, maybe with biofeedback. Is,
Sure.
what
It's
we're gonna
helpful,
do to
helpful.
really
How long has this
fix this.
fellow been
Is that
Dealing
the
with
young
this.
guy that he tried?
Yep.
Is that the one used so many sleeping pill and
oh,
he just up the dosage and eventually he
That's it.
couldn't.
Yeah.
Even
became
very
resistant to the
Yeah,
highest
yeah, he
doses
just
of
keep-
medicine.
sometimes he will purposely
wow.
combine alcohol and the sleeping pill to
Oh.
induce the sleep.
That's
Very dangerous.
suicidal.
Right.
Yeah.
It's very dangerous,
It
very
Yeah.
dangerous.
doesn't really work.
No,
It's
that's
dangerous. It's dangerous.
interesting.
Yeah.
Did you ever get to the core? Meaning, when did it start?
Kind of, we kind of have, but it's, it's challenging because it's an ongoing process of,
Yeah.
the person has to keep doing the work, to try to
Yes.
build in their
That's always the problem.
positive mechanisms and how they deal with stress, because
Right.
they have to relearn, a lifetime of bad habits
Yes.
of dealing with
That's
stress
it.
in the wrong way, and then
Yes.
masking it with medication for years and
100%.
years.
Yeah.
With the pandemic coming and then people having more anxiety and sleep issues, that really
Compounded
pushed so
compounded.
many people over the edge where they needed to be
Wow.
on medicine.
But I think the key
fasting.
thing, if you do a historic revelation in terms of what was their first memory of when they were alive, the first memory when this occurred. When they get to the core memories, you can unravel a lot of this. So you don't have to build layer of stress reduction. If you get to the cause, you can neutralize and disarm a lot of the stress reactions. But the cause is the key. First memories, causes, always changes everything.
Yeah, and I think,
But they have to be willing.
right. And I think that comes
Willingness.
from childhood, which is
Of course, yeah,
very
sure.
difficult for a lot of people
Deep.
to acknowledge, and when they're later in life, and
Yeah.
it's been 30
Judge
years or
themselves.
whatever, and trying
Yeah.
to figure out, right?
Yeah.
It's very
The willingness
takes
is
lot
a
of
critical part of healing. You have to be willing, and you have to want to be more conscious.
And
Those
make
two.
effort.
Yes,
Yeah.
correct.
Yeah.
Yeah. So sleep issue is so common. But
Yes, it's a
if
good
you-
issue to deal with. Yes.
Yeah, just rely on the medication the easy way. Don't change your lifestyle or your nutrition, and then you just keep going up the dosage, and eventually you have to have the procedure done. And that's not the lifetime procedure, right? You cannot do that forever.
Once you do it, I mean, you still have to put in the work to really fix it, because
Yeah, how
it's going
long
to
does
wear
that
off.
last?
The
after
core is still
Is
there.
6 months.
The core is
Usually
still there.
lasts,
It's
maybe
last
even
6 months?
Yeah.
And it's,
It's
but
covering it up.
it
Everything
covers
is a
it up,
cover.
and
Yeah.
sometimes it doesn't work for everybody.
No,
I think
that's
it's
right.
like 70% effective or so.
Oh,
That's
But
pretty.
then
That's a
they
pretty
get it
good number.
multiple
That's a good
times.
number. That's a good
Yeah.
number.
Right.
But still
Wow.
doesn't deal with the core, which is really where they want to go if they want to be peaceful.
Right.
Not just put out the fire, but prevent the fire.
Yeah.
Right.
I mean, that's with all modalities. I
Yes,
think
yeah.
the
Get to the
core
core.
is to not just get to the core of the problem, but to get to the core of who you are and
Yeah,
why are
very
you
true.
here on this earth, and
That's right.
Right.
That's right.
a lot of
That's where the
levels.
theological aspect
Yeah,
comes
that's
in.
really, really important, because if it's just a relief of symptom,
Yeah.
of course it's going to come back.
Yes, yes. So we have the whole team. If you do have chronic long-term insomnia, if you take the medication, you want to start it, like cutting down the dosage, you can go to Dr. Albert trying to add some herbs, and I can do acupuncture, and you can talk to about the stress and changing your thought with Dr. Handworker.
If you want to get to the core of the issue,
Yes.
you have to deal with the core of the issue.
And then you also practice Tai Chi and
Yes.
move the energy.
Breathing and Tai Chi, and yes, meditation. We also teach meditation. Different kinds of meditation for different people is very helpful too.
Yes, and then if you want to change your diet to optimize your blood sugar, your hormones, you go to our nutritionist. So Mrs. Handworker will give you the direction, what can make your nerve calm down so that you can get a good night's sleep. Thank you.
Thank you for listening.